Hello everyone, this is Medical Gateway, and in this part we're going to study transfusion reactions. Transfusion reactions from Guyton and Hall, textbook of physiology. Okay, so what exactly is transfusion reaction? The most common transfusion reaction is the mismatched blood transfusion. For instance, by mistake, a person having blood group A is transfused with the blood group B. Now, blood group B should not be transfused to blood group A. What will happen? The anti-B antibodies will attack the B antigen on the donor RBC. Okay, so whenever there is mismatched blood transfusion, the antibodies of the recipient blood will be attached and they will attack the antigens on the RBCs of the donor. Now these antibodies, when they attack the antigens, it will result into clumping of the red blood cells. And when there is clumping of the red blood cells, the blood vessels will be blocked. So antibodies attacking antigens and forming the clumping of red blood cells, this clump will block the blood vessels. And when the blood vessels are blocked, WBCs will come, the white blood cells will come, and they will attack the blocked and the clumped red blood cells, and they will destroy these red blood cells. So the red blood cells are clumped and they will block the blood vessels. So these red blood cells which are clumped and they are blocking the blood vessel, WBC will come, and the WBCs will hemolyze these, will break these red blood cells, resulting into hemolysis. Okay? And the second thing is that whenever there is antigen-antibody reaction, the antigen-antibody reaction will result into the release of some toxic substances. Okay? So antigen-antibody reaction, number one, will form clump. This clump will be hemolyzed by WBCs, resulting into hemolysis. And the second one is that antigen-antibody reaction will give rise to a lot of toxic substances. Okay, now this hemolysis, what this hemolysis is going to do. Now, whenever there is hemolysis, it means there is anemia, there is decreased in red blood cell number. And when there is anemia, it will result into the tissue ischemia. Low red blood cells have to carry oxygen to the tissues. So oxygen will be deprived of, so the tissues will be deprived of oxygen. So this is tissue ischemia. So because of hemolysis, one fate is the tissue ischemia. And the second one is that whenever there is hemolysis of the red blood cells, the hemoglobin appears in the blood, which is known as hemoglobinemia. Okay, so when the hemoglobin appears in the blood, that hemoglobin will travel to the kidneys, and the hemoglobin will be filtered out in the kidneys, and the hemoglobin will start to appear in the urine. So a lot of hemoglobin will come out of the red blood cells into the blood. From there they will go to the kidneys, and the hemoglobin will appear in urine. So appearance of hemoglobin in urine is hemoglobinuria. Urea is from urine. Okay? When a lot of the hemoglobin is in urine, this hemoglobin will deposit in the renal tubules. And when a lot of hemoglobin is going to deposit in the renal tubules, it will result into renal tubular blockage. So finally, hemolysis leading to hemoglobinemia causing hemoglobinuria, and hemoglobinuria is basically causing deposition of hemoglobin crystals in the renal tubules, blocking them. So there is renal tubular blockage. And whenever there is renal tubular blockage, it is basically a form of acute renal failure. So after the transfusion reaction, there is tissue ischemia and there is a chance of acute renal failure. And on the other side, antigen-antibody reaction are releasing toxic substances. And these toxic substances are causing generalized vasodilation in the blood vessels, causing circulatory shock. Circulatory shock means there is generalized vasodilation because of these toxic substances, and because of this vasodilation, the blood pressure falls. And whenever the blood pressure falls to the extent that the supply of the blood to the tissues is compromised, this is known as circulatory shock. Shock is that circulatory shock means that because of the vasodilation, the blood pressure has fallen to a very serious level, and this has resulted into the decrease in blood supply to the tissues. So this is circulatory shock. So when the blood supply to all the tissues of the body are decreased, blood supply to the kidneys are also decreased. And whenever the blood supply to the kidneys is decreased, it results into renal failure. So here, the renal failure is because of the renal tubular blockage, and here the renal failure is because of the circulatory shock caused by the toxic substances. And these are the two mechanisms of renal failure because of the transfusion reaction. There is a third mechanism of this renal failure because of the transfusion reactions, and that is these toxic substances are directly acting on the renal blood vessels, causing the vasoconstriction of the renal blood vessels. Okay? So the toxic substances are directly act on the renal blood vessels, causing their vasoconstriction. And whenever there is renal vasoconstriction to a lethal extent, it results into renal failure. So renal failure because of renal vasoconstriction, renal failure because of the circulatory shock, and the renal failure because of the renal tubular blockage. And also there is tissue ischemia. So this is the fate of the most common and the most lethal blood transfusion reaction, which is basically mismatched blood transfusion reaction. Okay, so this was mismatched blood transfusion reaction. See you in next part.